Hello, my name is Taylor. I'm a registered dietitian and board-certified specialist in oncology and nutrition. Today, we'll be talking about feeding tubes. In this introductory video, we'll be talking about the purpose of feeding tubes and how they can help you through your cancer journey. Stay tuned to learn more. While feeding tubes can be used in the treatment of many different types of cancer, the ones you'll see them most often used with are head and neck cancers. And that's because head and neck cancers and their associated treatments very often impact your ability to eat and chew and swallow. There might be a tumor in the first place that's actually blocking your ability to swallow and get food from your mouth into your stomach. There might be a surgery that you've been through that makes it difficult for you to get enough food from your mouth to your stomach, whether that's a permanent change or a temporary change. And there's also radiation treatment, which doesn't typically impact your ability to chew and swallow right away, but over time it becomes very painful, and that pain can decrease your ability to eat and swallow enough food. Now, this is a problem because it can lead to malnutrition. So malnutrition can occur very quickly, and it can be a problem for both people who are at a healthy weight to start and for people who are overweight and obese. So don't think that because you have extra weight to lose that it's okay, because with malnutrition you not only lose fat on your body, but you also lose muscle. Losing muscle is not a good thing. It's going to make you feel more tired, make you feel like you have decreased energy, and that built on top of the tiredness that you're going to feel from your cancer treatment is a really rough combination that you don't have to go through if you can keep your body weight nice and stable. Malnutrition and losing weight during cancer treatment can also make you have more side effects from the treatments and also make it take longer for you to heal. So the feeding tube is a wonderful solution because it helps you to keep your weight stable and prevents all of those negative side effects. So what is a feeding tube? Basically, it's a tube like this that gets connected into your stomach and can be combined with tools like this syringe, letting you put water and formula directly into your stomach without passing by your mouth or throat that may have been damaged by your cancer treatments. There are a couple different types of tubes, so let's take a look at those. The first tube that we'll talk about is called the NG tube, or nasogastric tube, because it goes up your nose and into your stomach. So the food or formula or water is put onto this end of the tube and goes directly into your stomach and doesn't require any swallowing. Because this tube is so easy to place, it's usually the first option for short-term feeding tube use. The PEG tube, or percutaneous endoscopic gastrostomy, like I said, PEG, the PEG tube is for longer-term use. Instead of going up the nose, it goes directly into the stomach, and then the end of the tube pops out through your abdomen or belly area. And you can use a syringe or bag to load the food or water directly into the stomach. This is a good option for people going through head and neck cancer treatment because it avoids the mouth and throat area. The J tube is another option that also avoids the mouth and the throat. However, this one also avoids the stomach because the end of the tube is placed in the jejunum, which is a part of the small intestine. You'll most commonly see this in people who have absorption issues with their stomach, or people who actually do not have a stomach. And no, that's not a joke. Some people have actually had theirs removed from surgery for various reasons. But as far as head and neck cancer treatment goes, the most often used tube is the PEG tube. We're going to focus on PEG tubes because that's what my patients usually end up getting for their head and neck cancer treatment. When it comes to PEG tube placement, it's usually an outpatient procedure, meaning that you go to and from the doctor's office or hospital same day and home with your new feeding tube. When it comes to feeding tube placement, usually what they'll do is go into your mouth with the tube, down your throat, and then pierce it out through your stomach. Now, then they'll pull the tube out, but they don't pull it all the way out. It's held into place. It might be held into place with a little balloon that they'll fill with saline, or it might be held into place with something like this little mushroom-looking thing here. And as you can see here, there's the inner part of the tube, and that is actually where the formula or the water that you put into the tube comes out and into your stomach. So that's what holds the tube into your stomach. And then on the outside, they might slide a little bar or something like this little plastic circle here to hold it tight against your skin. So on one side, you have it holding it against your skin, and on the other side, you have a mushroom or a balloon holding it into your stomach. It's usually pretty snug, and you don't have to worry about it wiggling around too much or falling out very often. Now, as far as soreness goes, it is usually pretty tender that first day. Some people walk a little hunched over because it's sore, but in most cases, within a few days, you are just fine, and you're able to do any of the activities that your doctor approves. One of the most common feeding tube questions is, how long will I need it? It very much varies from person to person, so it's important to talk to your doctor about why you're getting it and how long they think it will be in place before you actually get it, so you know what to expect when you're going into the feeding tube experience. For some people, it's just a couple months. Other people, it might be lifelong, so it's important to know what it's going to be for you beforehand. Now, on average for my head and neck cancer patients, I would say expect a minimum of 3 months, and that's enough time to get you through your radiation treatment and to let your mouth and throat heal back up so you can go back into eating. In some cases, it might go to 6 months, a year, or longer if you're not able to get your swallowing function back to where it was. Now, to get back to swallowing normally, I recommend working with a speech-language pathologist, or SLP. They can give you exercises and help you safely swallow so that you're able to eat food by mouth again. Now, when you wean off the feeding tube, typically what's recommended is that you eat all of your food by mouth for 2 weeks without using the feeding tube at all, and keep your weight stable. If you can do that, then you can start talking to your doctor about getting the feeding tube taken out. Thank you so much for watching this video about the importance of feeding tubes for preventing malnutrition in head and neck cancer patients. Please check out my other videos about how to use feeding tubes and how to take care of your feeding tube if you have any further questions. Again, my name is Taylor, and I hope that you have a happy and healthy day.